What causes vitamin D deficiency? You can become deficient in vitamin D for different reasons. You don't get enough vitamin D in your diet. There are foods that have a lot of vitamin D, but there are other foods that have very little vitamin D. So it is important what kind of foods you are taking. What's your diet plan? You don't absorb enough vitamin D from food. That is also possible. There may be a malabsorption problem. You are having diet full of vitamin D, but unfortunately your body cannot absorb it. That's a malabsorption problem. You don't get enough exposure to sunlight. This is another reason. If you do not have sunlight, you won't get vitamin D properly. But the other thing is that even when you have enough sunlight, you cannot get vitamin D because your skin has a problem. It cannot convert the sunlight into vitamin D. Your liver and kidneys also play important roles. If your kidney doesn't function well, if your liver has a problem, then what happens? Your body cannot convert vitamin D and cannot take it into the blood. You take medicines, that's also very important. What kind of medicines are taking? Any medicines have bad side effect. Medicines are not good for health, but in case of emergency you can have some medicines, and there are special medicines that interfere with your body's ability to convert or absorb vitamin D. Let's find out who are at risk of vitamin D deficiency. Breastfed infants are at risk because they are having breast milk, and breast milk is not much with vitamin D. You have other vitamins and minerals in breast milk, but the thing is that vitamin D may not be that much, so the children may have deficiency of vitamin D. In that case, even an infant can have a supplement of 400 IU of vitamin D every day. Though it's not good, if it is not possible in other way, alternative way, yeah, this is possible. Older adults, those who are old enough, maybe 65 years old, maybe 70 years old, they have problem with their skin. That skin doesn't make vitamin D when the old people are exposed to sunlight because of the problem with their skin. The older you are, the more problematic may get your skin, and that may result in vitamin D deficiency. People with dark skin, African people, black people, have a little possibility to have enough vitamin D conversion. The problem is white people have more ability to produce vitamin D, but black people have less ability to produce vitamin D from the sun. People with conditions that make it difficult to absorb nutrients from food, such as there are some diseases. If you have Crohn's disease, if you have ulcerative colitis, if you have celiac disease, then you are going to have little absorption. So the vitamin deficiency may occur when you have either Crohn's disease or ulcerative colitis or celiac disease. There are also people who have obesity. That may be another reason that you will not get the vitamin D absorbed in your body, in your blood. What happens when you have obesity? You have a lot of fat in your body, and that body fat binds to some vitamin and prevents it from getting into the blood. So you may turn up having deficiency, vitamin D deficiency. People who have had gastric bypass surgery, there's a kind of bypass surgery, a type of weight loss surgery. Some people undergo weight loss surgery that is called gastric bypass surgery. If you have this, there may be something wrong with it, and this can also make your vitamin conversion less. It can help absorb not much as it is supposed to have. People with chronic kidney or liver disease, as I said before, chronic kidney disease is responsible for little conversion of vitamin D. Liver disease is another important problem that can occur, that can create vitamin D deficiency, because they affect your ability to change vitamin D into a form of your body can use. People who take medicines that affect vitamin D levels, they may include cholesterol, anti-seizure, steroid, and weight loss medicine. So if you are trying to control cholesterol level with medicine, if you try to control anti-seizure medicine, if you are having steroid medicine, if you have weight loss medicines, then it's probably going to bar your conversion vitamin D may not get convert properly. So what can you do if you have vitamin D deficiency, and what may be the problems you will suffer if you have vitamin D deficiency? Suppose in children it can cause rickets, so it's very dangerous. The bones get turned, twisted, right? So rickets is a rare disease that causes the bones to become soft and bend. So as it becomes soft, it bends. So this is very bad. The leg may bend, the hand may bend, and that means the child will get impaired. African American infants and children are at higher risk of getting rickets. So what happens if American people marry African people, or African people marry American, or African people start living in America, and if they have children, these children are at higher risk of getting rickets. In adults, severe vitamin D deficiency leads to osteomalacia. Osteomalacia causes weak bones, bone pain, and muscle weakness. So this is vital. Someone having this problem, weak bones, someone having bone pain, someone having muscle weakness, may be because he has or she has vitamin D deficiency. How can I get more vitamin D? That's a very, very $1,000,000 question. Fatty fish is a good source of vitamin D. What fatty fish include? That is salmon, tuna, and mackerel. So if you have the kind of fish, fatty fish, fish from a river, salmon, tuna, and mackerel, that can lead to vitamin D gain. Beef liver is also very good. So if you were supposing the sacrifices in the Islamic world, what happens? We slaughter and we have beef a lot, so we can get beef liver. So if you have problem with liver, it helps little to get the vitamin D conversion. It's a problem if you have kidney problems, chronic kidney problems, you cannot get vitamin D conversion as much as it should be. So beef liver can help you a lot. Cheese you have to take more. Mushrooms can help you, and egg yolks the best food. You see, egg yolks you have to have. Don't worry about heart, this is good for your heart. So if you have egg yolks, can absorb, can get vitamin D. You can get rid of vitamin D deficiency. You can also get vitamin D from fortified foods. You can check the food labels to find out whether food has vitamin D. Foods that have often added vitamin D, they include milk, breakfast cereals, orange juice, other dairy products such as yogurt, soy drinks. Alright, this is another question. Can too much vitamin D be harmful? So if you have deficiency, it is bad. Rickets for the children, bone density gets lower, the bones get softer and they become fragile. But what about if we have a lot of vitamin D, much more than we need? Getting too much vitamin D, that is vitamin D toxicity. So vitamin D deficiency, when you have less amount of vitamin D than the body requires. But here you have the vitamin D toxicity. If you have a lot of vitamin D, then it will get toxic, and this can be harmful. Signs of toxicity include nausea, vomiting, poor appetite, constipation, weakness, weight loss. So if you have a lot of vitamin D, there may be some sign like You will have nausea, you have vomiting, you may have poor appetite, you don't feel good to eat food because of excessive vitamin D. Constipation, problem with your stool, weakness and weight loss. These are the reason too much of vitamin D. Very high levels of vitamin D can damage the kidneys. This is another problem. If you have a lot of vitamin D toxicity can damage your kidneys. Like you have carambola. Carambola is a nice fruit, but the problem is if you have problem with kidneys, then you should not have carambola, because when you have carambola, you will have some neurotoxic gas, neurotoxicity. Because of the kidneys, you can get rid of the toxicity, but if you have problem with kidneys, if you have carambola, then it may be a problem. It can go up in your brain and there may be brain fog and it can kill you, right? So when you have problem with kidneys, you should not have carambola. It also raises the level of calcium in your blood. So this is very dangerous. If you have calcium in your blood, that's really dangerous. So what happens if you have a lot of vitamin D in your body? The level of calcium in your blood will go high. High levels of blood calcium, that is hypercalcemia, can cause confusion, kidney failure and irregular heartbeat. So when you have kidney problem, you cannot absorb vitamin D. And if you have excessive amount of vitamin D, then your kidney can get damaged. Kidney failure may occur, irregular heartbeat, that is arrhythmia, may occur. Most cases of vitamin D toxicity happen when someone overuses vitamin D supplements. You cannot get too much vitamin D from sun exposure because the skin limits the amount of vitamin D it makes. So it is very important when you have supplements, and if it goes more doses, then what happens? Vitamin toxicity can occur. But when you have a lot of sun exposure, it will not get a vitamin D toxicity because the skin will protect it. The skin will not allow more than enough, right? Will not allow vitamin D that is more than enough. So when you have natural vitamin D, you won't have it. That's it for now. Thanks for watching.